Good evening, guys. I have discussion C for you. Now, tonight for C, we're discussing medical assistance in dying. Okay? Canada's version. So here we go with the presentation I made. Please enjoy. Sit back and enjoy, please. Okay, here we go. The phrase medical assistance in dying. Story highlights troubles of aging generation. Is a news headline saying that a recent report about medical assisted medical assistance in dying or MAID, a legal physician supervised option for ending life, has drawn attention to broader problems faced by older people. Frail health, heavy hair, heavy caregiving burdens, gaps in long-term care and social supports, and the emotional and ethical strains those create. What the surrounding article describes. A specific case used as an example. The editorial recounts an Ontario couple, Mr. and Mrs. B, in their 80s, after a difficult coronary bypass and complications. Mrs. B became dependent on her husband for daily care and asked him to explore MAID. The story focuses on how the couple's situation led them to consider assisted death, how MAID works in contexts. The piece explains MAID's role in Canada since 2016 as a regulated pathway requiring medical assessment and approval, and it uses the couple's experience to show how MAID can become an option when other supports fail. Why the story highlights troubles of the aging generation, caregiver strain, and lack of support. The story illustrates how older spouses often become primary caregivers despite their own frailty, creating an unsustainable physical and emotional burdens that can push families toward MAID as a perceived solution. Health complications and prolonged recovery. Major surgeries and chronic illnesses can leave older adults with long, difficult recoveries and reduced independence, increasing reliance on informal care that may be unavailable or inadequate, social isolation, and quality of life concerns. Reporting on MAID decisions often surface themes of loneliness, loss of autonomy, and the desire to avoid prolonged suffering become a long term burden on families. Broader policy and ethical questions the article raises. Are social and health systems failing older people? The editorial uses the made case to question whether better health care, rehabilitation, respite for caregivers, and long term care options might reduce the number of people who see assisted dying as their only humane choice. Safeguards and consent under strain. When frail older adults and exhausted caregivers are involved, the article prompts debate about how assessments ensure decisions for made are truly voluntary or not, driven by lack of alternatives. Key takeaway. The headline signals that the made story is not just about one assisted death case. It's being used by the author to spotlight systematic problems affecting many older adults, inadequate supports, caregiver burnout, and difficult end of life choices, and to prompt public discussion about whether health and social policies are doing enough for an aging population. The piece you are pointing to is a personal, reflective story about a child's experience of a parent choosing medical assisted dying, medical assistance in dying, and the complicated emotions that follow. What the headline means. Love, grief, and assisted dying signals the signals a first person or human interest story that links three things: the emotional bonds between family members, and the sorrow and complexity of bereavement, and the legal medical process of medical assisted dying. The headline promises a close, humane, look at how love and loss shape decisions about assisted death, what the article actually covers. The article is a reflective account by Michelle Elliott about her mother's decision to use MAID in Canada, where it is legal. It describes the lead up to the death, the day itself, and the author's linear life, gratitude, relief, confusion, and grief as she navigates a planned medically assisted death. Central emotional themes: anticipatory grief and mixed feelings, knowing the date or plan for a loved one's death creates a blend of mourning, relief, and sometimes guilt. Love as motivation and restraint. Family members often want to honor a loved one's wishes while also struggling with the finality of the choice. Stigma and isolation. Because assisted dying remains controversial in many places, families feel judged or unsupported, even as they try to do what they believe is right. Ethical and social questions the piece raises. The story uses a personal case to surface broader issues. How societies support people with terminal illnesses, whether legal frameworks protect truly of voluntary choice, and how cultural attitudes shape bereavement after MAID. The article invites readers to consider both individual dignity and systematic gaps in care. This is not just an account of a medical procedure. It's a look or it's a exploration of how love and loss interact when death is planned and assisted. The piece aims to humanize MAID by showing the emotional reality for families and to prompt reflection on how communities and health systems respond to end of life choices. Okay, guys, that is your C for tonight's. I will try and do a D in a little bit. For now, Gator Wellness, take care, folks.